Welcome everyone to our health-focused video. Today we're delving into the topic of how to recognize early symptoms of diabetes. It's a fundamental issue that concerns millions of people worldwide. Diabetes, as most of you may know, is a chronic ailment that drastically affects the way your body handles glucose, which is another term for sugar. Glucose is a crucial element for our body. Derived mainly from the food it serves as a significant source of energy required to perform various bodily functions. But imagine what happens when your body's capacity to process this energy source begins to falter. That's when we start talking about diabetes. Diabetes is a term that actually encompasses two primary categories, type 1 and type 2 diabetes. Each form of diabetes has its unique characteristics that differentiate it from the other. Type 1 diabetes, or insulin-dependent diabetes, is a condition where your body fails to produce insulin. This failure happens because your immune system erroneously attacks and destroys the insulin-producing cells in the pancreas. This type of diabetes is usually diagnosed in children and young adults, although it can appear any age. Patients with type 1 diabetes need to take insulin every day to stay alive. On the other hand, type 2 diabetes, or non-insulin-dependent diabetes, is a chronic condition where your body doesn't use insulin properly. It begins with insulin resistance, a condition in which the body resists the effects of insulin. As a result, the body needs more insulin to bring glucose into the cells. Eventually, the pancreas cannot keep up, and the blood sugar levels rise. Each of these forms of diabetes has its unique challenges in terms of management and treatment. They require different strategies, and the key to controlling diabetes is early detection and understanding the disease. Detecting diabetes early is of paramount importance. It opens the door for timely and effective management of the disease. The first step in managing diabetes is understanding its symptoms and recognizing them in the initial stages. Early diagnosis of diabetes can prevent many complications such as heart disease, stroke, kidney disease, and eye problems. It can lead to earlier treatment and can delay the progression of the condition. The sooner you know about it, the sooner you can start making lifestyle changes that will positively impact your health. Early detection also means that you can slow down the progression of the disease. Diabetes is a condition that can be managed effectively if detected early. It does not mean a death sentence. It means you have a chance to take control of your health and live a fulfilling life even with diabetes. Now that we have a basic understanding of diabetes, its types, the role of insulin and glucose, the importance of early detection, and the complications that can arise if it goes undetected, let's delve into its early symptoms. So, what does diabetes look like in its early stages? Here are some common symptoms to watch out for. First up, frequent urination. It's not just about having one too many cups of coffee. If you find yourself making more trips to the bathroom than usual, especially at night, this could be a sign. Our bodies try to get rid of the excess sugar in our blood, and one way they do this is through increased urination. Next, let's talk about weight. Unexplained weight loss is another symptom. You may be eating the same amount or even more but still losing weight. This happens when your body isn't managing to get enough energy from the food you eat, and instead starts burning fat and muscle for energy. Another symptom is constant thirst. Now this isn't just about feeling a bit parched after a run, it's a persistent thirst that just doesn't seem to go away no matter how much water you drink. This can be a result of your body trying to compensate for all that extra urination. Then there's the fatigue. If you're feeling tired all the time, even after a good night's sleep, it could be a symptom. Diabetes can make you feel low on energy because your body isn't able to use sugar properly for fuel. And lastly, let's not forget blurred vision. This isn't about needing a new pair of glasses. High blood sugar levels can cause fluid to be pulled from the lenses of your eyes, which can affect your ability to focus. These are just a few common symptoms, but remember, everyone's body reacts differently. If you notice any of these symptoms or other changes in your body, don't hesitate to reach out to a healthcare professional. It's always better to catch things early and take action. After all, knowledge is power, and the more you know about your body, the better you can take care of it. These are just a few common symptoms, but remember, everyone's body reacts differently. Now, let's discuss some less common but equally important symptoms of early diabetes. These signs might not be as apparent as frequent thirst or increased urination, but they are still crucial indicators of this health issue. One such symptom is blurry vision. This doesn't mean a sudden need for reading glasses. Rather, it's a kind of fuzziness or lack of clarity in your sight. You might notice that it's harder to focus on objects or that everything seems a bit hazy. This happens when high blood sugar levels cause the lenses in your eyes to swell, affecting their ability to focus. Next, let's talk about slow healing of cuts and wounds. If you notice that even minor scrapes are taking longer than usual to heal, it could be a sign of early diabetes. This is because high blood sugar can affect blood flow and cause nerve damage, making it harder for your body to heal wounds. Another less common symptom is constant fatigue. Now, we've all had those days where we feel tired no matter how much coffee we drink. But with early diabetes, this fatigue is different. It's a persistent feeling of exhaustion that doesn't go away with rest. This happens because the body can't effectively use glucose, the main source of energy, leading to this constant tiredness. It's also worth mentioning that these symptoms might not always present together. You might only experience one or two, or they might come and go. But remember, these less common symptoms are just as important as the more known ones in identifying early diabetes. While these symptoms might seem less common, they are equally important to recognize. If you or someone you know is experiencing these symptoms, it's important to consult a healthcare professional. Early recognition and treatment of diabetes can prevent more serious health complications down the line. So, let's take these signs seriously and strive for a healthier future. Understanding the risk factors of diabetes can help you recognize the symptoms earlier. So let's delve into some of these factors. The first one we'll discuss is obesity. Obesity is a key risk factor for type 2 diabetes. When a person carries extra weight, especially around the belly area, it can cause the body's cells to become resistant to insulin, the hormone that regulates blood sugar. This resistance can lead to higher levels of glucose in the blood, setting the stage for diabetes. Next, we have family history. If diabetes runs in your family, you might be more susceptible. Research shows that people with a parent or sibling with diabetes are at a higher risk. It's not about the diabetes gene, but more about shared lifestyle and dietary habits that can increase the likelihood of developing the condition. Age is another crucial factor. While diabetes can strike at any age, the risk increases as we get older, particularly after the age of 45. As we age, our bodies become less efficient at using insulin, and we tend to exercise less and gain weight, all of which can contribute to the development of diabetes. Another risk factor worth mentioning is a condition known as prediabetes. In prediabetes, blood sugar levels are higher than normal but not high enough to be classified as diabetes. Without intervention, prediabetes is likely to become type 2 diabetes in 10 years or less. Lastly, if you've been diagnosed with gestational diabetes during pregnancy or given birth to a baby weighing more than 9 pounds, your risk of type 2 diabetes increases. So understanding these risk factors, obesity, family history, age, prediabetes, and gestational diabetes, can help you be more proactive about your health. It's important to remember that having one or more of these risk factors doesn't guarantee you'll develop diabetes, but it does increase your odds. Knowing these risk factors can help you stay alert and recognize the symptoms early. You might wonder, why is it so important to detect diabetes early? Here's why. Just like a small leak can sink a giant ship, a seemingly insignificant rise in blood sugar levels can cause a cascade of health complications if left unchecked. Early detection of diabetes is crucial because it allows for early intervention. It's a bit like catching a weed in your garden when it's still small. It's far easier to deal with it then, rather than waiting until it's taken over the entire yard, right? Similarly, when diabetes is caught in the early stages, it's much easier to manage, and the risks of developing severe complications are significantly reduced. One of the most vital benefits of early detection is that it helps prevent or delay complications associated with diabetes. These can be serious and life-altering, affecting various parts of the body such as the heart, kidneys, eyes, and nerves. By identifying diabetes early, you have a chance to take proactive steps and prevent these complications from developing or worsening. Another key aspect is that early detection allows for better management of the condition. It's about staying one step ahead of the game. When you know you have diabetes early on, you can take immediate action to control your blood sugar levels through dietary changes, regular exercise, medication, or a combination of these. Moreover, maintaining a good quality of life is an important goal for all of us, isn't it? Well, early detection of diabetes plays a significant role in that. By managing your diabetes effectively from the beginning, you can continue leading a fulfilling life, doing the things you love with the people you care about. Remember, knowledge is power. The earlier you know about your diabetes, the more control you have over your health. It's not just about adding years to your life, but also about adding life to your years. Early detection of diabetes can make a world of difference in your health journey. We've covered a lot of ground today in recognizing the early symptoms of diabetes. We've talked about the common symptoms like frequent urination and excessive thirst, to the less common ones like blurred vision and slow healing wounds. We've also discussed the risk factors that can predispose you to this condition, and the importance of early detection. Remember, knowledge is power. Being aware of these symptoms and recognizing them early could potentially save your life or the life of someone you love. It's always a good idea to consult with a healthcare professional if you notice any changes in your body that concern you. Your health is your wealth, and it's crucial to keep on top of it. If you found this video helpful, please leave a comment below. Don't forget to subscribe and like the video. Stay healthy, stay informed, and we'll see you in the next video.